Hi, welcome, folks, and thank you for coming to this year's Nursing Informatics presentation. I'm Nurse Cindy, and I've been practicing for the last 2 years. Currently, I work in the emergency department at ECMC. Now more than ever, especially in our current climate of facing the novel coronavirus pandemic, we rely heavily on the use of information systems to provide safe and effective patient care. When we hear the words innovator, autonomous, and knowledgeable, the first thought that should come to our minds is the nurse in the role of a knowledge worker. According to McGonigal and Mastrain, knowledge workers are innovators, and they work that they produce is the foundation for organizational sustainability and growth. They are specialized, have advanced education, and typically have a high degree of autonomy and control over their own work environments. As clinicians, our overall goal is to know how to use the resources available to us, continuously seek new theories and technologies to make providing care easier and more beneficial for our patients. Being a master's prepared knowledge worker in the role as a nurse practitioner, one way I will use a combination of my clinical skills and nursing informatics available to me is to provide an individualized care plan for each patient. Many individuals suffer from modifiable diagnoses such as hypertension, hypercholesteremia, and diabetes. It is important to track the effectiveness of each patient care plan to be able to be flexible to tweak based on patient compliance to achieve positive outcomes and develop self-advocacy among patients when it comes to their own care. As we talk about being masters prepared and its relevance to patient care, we must delve a little into the technology we utilize that not only improves patient safety and satisfaction, but is also cost effective. Although we hate to mix the two together, we cannot have one without the other. Institutions every day see financial waste in every clinical area and seek to minimize the fiscal loss. One area in which we can save money while promoting patient care is through telenursing. Telenursing can be used post-ER or hospital discharge to ensure that patients are understanding and following their discharge instructions, and if any, barriers that may exist in their ability to be compliant with their care. Telenursing can go beyond a voice over the phone, but through face-to-face interaction via the computer, smartphone, or a tablet. It allows for patient re-education, monitoring, and counseling if necessary. Many patients are often shy to ask questions prior to discharge, or may have questions later that they didn't have time to think of prior to their discharge. This technology allows for mainstream continuity of care, and it serves as first contact to determine if the chief complaint can be taken care of with a visit with their primary care physician, or it may be necessary for an urgent care or ER visit. By doing so, it saves the patients their time and their wallets. And in this economy, we definitely need to make sure we're taking care of our patients' wallets. Now, while I can go on with this broad topic, for which much discussion is warranted, my time is up, and I do appreciate your viewership.